psychology, we shift our focus to group therapy, a form of therapy that conjures up immediate stereotypes for many people. How many of you remember the classic group sessions held by Dr. Hartley's office on the Bob Newhart show in the 70s? This was a wonderful collection of idiosyncratic people who came together to exchange feedback and support. Actual group therapy can be a remarkable experience for both the participants and the counselor. As a counselor, I've experienced personal growth from every group I've ever led, and believe it's impossible to have that level of consistent intimacy with others and remain unaffected. Tonight, we are fortunate to be joined by Dr. Alan Kessler. He is on the National Registry of Certified Group Psychotherapists and a clinical member of the American Group Psychotherapy Society. Welcome, Dr. Kessler. I want to thank you for joining us. It's a treat to have somebody of your 15 years experience leading groups. That's quite a specialty, really.
Yes, thank you. I'm glad to be here.
Yeah. You know, it's funny when I talk about group therapy, people really do have images in their mind about what that is, and I know you come from a more developmental psychology place, or you have perhaps a broader view of group therapy than today's sort of managed care, in and out therapy. So I'm glad you're willing to come and talk about that with us. Because in many ways, you're sort of the classic in terms of group therapy. I don't mean that to be insulting, but I mean, it's, actually, I think it's a good thing.
I hope it's not like the Model T Ford.
No, no. A little more progressive than that. In terms of group therapy, what attracted you to doing it in the first place?
Groups they're very full of emotion and feeling, and the atmosphere of a group is often that way. People can feel very close and have just a very good feeling being together, and people can feel very affected by a group. And having done groups and been in groups, I just found them very helpful in those ways, very moving and very helpful at the same time.
Well, I imagine there's particular issues that people have that really particularly lend themselves to group therapy.
Right.
I'm sure maybe you could speak to a few of those.
Yeah. Well, in particular, relationship difficulties. And relationship difficulties are very often associated with depression.
Okay.
But in terms of relationship difficulties, anything from shyness to being angry often in a relationship, or not being able to maintain a relationship, feeling very insecure all the time, like someone is going to leave me, doing for others, and to the point of great self-sacrifice and not expecting people to do back for one, being insulted all the time in a relationship. Just a whole multiplicity of things that people get in difficulties with in relationships. So
one of the benefits of group therapy is the ability to get perceptions of you from a variety of different sources. I would guess in a safe environment. In other words, if I think people are constantly picking on me, and I go to group therapy, I'm probably going to get some feedback from people other than the therapist about how I present myself.
Right. Right, that's true. I mean, both in the sense of whether people really are intending to pick on you, or maybe even that somehow one might be even setting things up in a relationship that led to being picked on to some degree. Because we have a tendency to do that. We have a tendency to sort of repeat relationships a lot in our lives, even very harmful relationships.
Well, we sort of do what's familiar. So in some ways, different than individual therapy, we get multiple pairs of eyes seeing us at one time.
Right.
Yeah.
And multiple opportunities to relate to people.
Okay.
We can relate to men and women. We can relate to outgoing people, inward people.
Okay.
And we could see the difference between people and the way they handle different emotions and handle other people.
So it can really get a sense of other people, of the fact that my reality is not the only one.
Correct.
Which is, I think, a lot of times where I know I get stuck at times, which is, well, of course everybody thinks like I do, you know, and that's a marvelous opportunity to have that challenged.
Right. Both that and often we feel very alone with our own thoughts. Yeah. Often the parts of ourselves that we feel most alone with, which tend to be very scary parts of ourselves, that is often discovered in a group that we're not so alone with it at all.
Yeah.
And that's often very shocking to group members, is how very similar they are in the very ways that they thought they could never, ever express to somebody else or express at great risk.
Okay. So sort of that breaks that sense of I'm all alone. Let's take a look. You know, I have some prepared a couple graphics in terms of curative factors or things that seem to work about group therapy.
Okay.
Let's take a look at the first one, and we'll take a look
Sure.
at those and then review them. The first few are the installation of hope, universality, providing a safe container to form new relationships, and a corrective recapitulation of the primary family group. And I have those in front of me, so if you didn't
Okay.
memorize them, that's all right.
Okay.
So it sounds like this installation of hope is sort of what we were talking about, which is, gee, if other people can feel this way,
Correct.
or if other people can get better, you know, maybe I can.
Absolutely, right. And often people will see other people handling something successfully in a group. There may be tension between two group members, or a group member may express some sort of liking of another group member or attraction to another group member, or whatever it is, you know, and someone else in the group, let's say I was the other group member, might be very afraid of that.
Okay.
But they'll watch what happens to those group members, you know, and that will make it somewhat safer for them to take that risk themselves.
Okay. So we get to see that, you know, in our imaginations, maybe we feel like conflict has to mean this terrible exchange, and I get to watch somebody do it in a way that
Right.
has a positive
Right.
outcome. Yeah.
Right. And interesting, people think both conflict has a terrible price to it, or and intimacy can have a terrible price, because intimacy can lead to rejection and abandonment, and or wanting someone to like me or need me or whatever, or respect me, you know, is often a very feared thing, you know, and if I open up, I'll be rejected and I'll be a bad person. And so both sides of that, you know, the honesty about hurtful or angry feelings or tension or conflict or disagreement, and the other side of it also, the part of just wanting to be together, have a lot of risk. And people can check that out in a group and see that, you know, often the worst fears do not come true. In fact, what actually seems to happen is people become much closer.
And in fact, they get to see what's possible for them too. Now, in fact, the second one, universality. That must refer to what we were talking about before, which is, gee, I'm not the only one that thinks this way. I'm not the only one that has this difficulty.
Right. That this is something in being human.
Yeah.
You know, it's really strange. We all walk around, and in some part of our minds, we think we feel a certain way, and we're different than every other human being on Earth. You know, and we don't. What it is that we don't accept that part of ourselves. And in a group, you know, we begin to see, you know, this part of myself is that I'm not accepting the part of myself, and in a way, I'm treating myself that I'm not human.
Yeah.
And in a group, we're in a group with other human beings, and you know, we're very social beings.
And we get a chance to, it sounds like, you know, we walk around the world in various roles, in various masks, and various, you know, well, I can be accepted based on my performance and what I do.
Yes.
And it sounds like what this opens up is a chance to say, okay, maybe I share both what's positive about me and what's not positive about me.
Right.
And that's something that could actually be a healing experience because it takes some of the pressure
Right.
off, I would guess. I mean,
Oh,
what do you think?
tremendously. Because often what I might think as a group member is not positive about me is really, it's not that I'm good or bad, but it's very understandable.
Yeah.
And it was really a way to deal with my feelings, maybe at a younger time in life, in the absolute best way that I could. And it doesn't mean that I'm bad, it just means I did the best that I could.
Yeah.
And once it's exposed to the light in a group, one can kind of begin to shift that. Maybe there's a better way to deal with those feelings inside of me.
Well, and to honor the survival behavior that we've outgrown.
Exactly.
You know, we're not in that situation anymore. We don't have to do that.
Right.
Well, and that's where the providing a safe container to form new relationships would come in, which is, it sounds like you've got this group structure where I know that the rules of confidentiality still hold.
Correct.
In the sense that what's said in the room stays in the room. So people do have a safe place to sort of be exposed with a minimal of risk.
Right.
Yeah. Okay.
Right. That's part of what makes it possible for people to take the risk, that the group tends to be much safer. You know, and even if differences occur, they can be looked at, they can be sorted out, instead of the feelings that are involved leading to even becoming overwhelming somehow or leading to rejection. They can be resolved and soothed, and people can go on.
Okay, so
and that can be taken outside of the group then. People can, with that new sense of how to relate in a more positive, more productive, more fulfilling ways, people can go outside of the group and relate a little differently. And as this is all happening, people are changing inside. They're getting a whole new sense of themselves in relation to other people and how they can be relating to other people.
Okay, so in fact, people get to use group also as a place to report risks they're taking out there and get some support for doing that.
Right.
Okay.
Groups tend to happen on both levels, really. People share their feelings in relationships on the outside of the group, and very importantly, they share their feelings and relationships inside of group.
Okay. So when you have a group therapy, particularly, I know some of your groups run a couple of years. Do you have a no contact between sessions rule?
I do.
You do? Okay.
Right. Because I think it's very important to deal with the feelings that occur in the group, in a group. You know, we can't help when we're relating to each other to try to deal with some sort of emotions. And if, let's say, you and I were in a group together, and we would have some sort of emotions towards each other.
Sure.
And once we're outside the group, if we start talking, we're always trying to deal with our feelings towards each other in one manner or another, whether it's that I might want to be accepted by you, whether I might have been a little hurt by you in the group or something like that. There's a way I would try to tell you that if I spoke to you outside of the group, but then it can't be sorted out.
And plus, we've missed the opportunity as a group to process that.
That's right.
We're going to take a quick break, and then we'll be back. Stay with us. When we return, we'll learn more about why group therapy works. Cool.